All right, abdominal and genitalia injuries. So we'll look at eviscerations of pale objects and blood plating. You got some solid and hollow organs. Abdomen is the lower of the two major body cavities. It extends the diaphragm to the pelvis. Contains organs that make up digestive, urinary, and genitourinary systems. Injuries to the abdomen that go unrecognized or untreated are the leading cause of traumatic death. So you divide into four quadrants. Diaphragm is the divided line between the thoracic and abdominal abdomen. And you divide it up into the right upper, left upper, right lower, and left lower quadrant. Hollow and solid organs. Patients could lose all of the circulating blood volume into the peritoneal cavity without any visible external bleeding. Hollow organs are structures through which material passes, more resilient to blunt trauma, and less likely to be injured by trauma, unless they are. Solid organs include the liver, spleen, pancreas, and kidneys. Injury can cause severe hemorrhage, abdominal pain from penetrating or rupture of solid organs has a slow onset. There's difficult organs of the abdomen. The urinary system controls the discharge of certain waste materials filtered from the blood of the kidneys. The reproductive system controls the reproductive process from which life is created. So hemorrhage can occur with external and internal blood loss. Peritonitis and numerous peritoneum injuries to hollow solid organs can result in spillage of the contents into the abdominal cavity. Irritation of the nerve endings occur. Pain is localized and the extent of contamination is confined. Peritonitis is an intense, potentially life-threatening inflammatory reaction. So the first signs are severe abdominal pain, tenderness, and muscular spasm. Pneumoperitoneum, rupture of a hollow organ, perforated peptic ulcer, and recent abdominal surgery or rupture of an abscess. So closed abdominal injuries, compression injuries, they're typically caused by poorly placed lap belt, deformed hollow organs, increasing the pressure within the abdominal cavity. Deceleration injuries occur when a person or the vehicle in which he or she is traveling strikes a large immovable mass. Crushing injuries result in external factors at time of impact, so the solid organs are at the greatest risk with crushing injuries. Shearing may cause tears from a ligament, tears habitus, so some signs sentinels are those that follow. Crepitus in the lower rib areas is a cure sign. Pain that allows the angle of the lateral part of the hip to the midline of the groin can be the result of damage to kidneys or the ureters. Voluntary or involuntary guarding, bruises in the right upper quadrant, left upper quadrant, or flank may suggest an injury to the liver, spleen, or kidney. Bruises around the umbilicus, colon style, are predictive of significant internal abdominal bleeding. Injuries from seatbelts. Seatbelts cause blunt injuries to abdominal organs. If too high, it can squeeze the abdominal organs or great vessels against the spine. Small children and short people who are in the front seat of the automobile may be at risk of injury when the airbag is deployed. Inspect beneath the airbag for signs of damage to your steering wheel in these cases. Gunshot wounds involve injury to the small bowel, colon, liver, and vascular structures. And stab wounds to liver, small bowel, diaphragm, and colon are frequently injured. Evisceration goes all the way through the skin and muscle layer and through the fascia, resulting in bowel protruding through the skin. There's your signs and symptoms. So, injuries to the specific structures. The diaphragm, abdominal organs may be pushed upward into the thoracic cavity. Patients exhibit dyspnea or feel short of breath, abdominal respiration sounds, abnormal respiration sounds, in an abdomen with a sunken concave anterior wall. Causes signs and symptoms to ventilatory compromise. Injuries to the kidney causes pain on inspirations into the abdomen and flank. So injuries are rarely occur in isolation. Liver and spleen, also the pancreas, intestines, and stomach. All these pains are going to be in the quadrants that they occur and in which these organs lie. So any kind of rigidity, pain upon palpation, or bruising and contusion that you see is indicative of injuries to each one of these organs. So, with the urinary bladder, the urine may be spilled into the abdominal cavity, so it's going to cause irritation to that cavity also. So, the external male genitalia, testicular torsion occurs as a result of trauma. Penis injuries may result in blunt or penetrating trauma and sexual behavior or self-mutilation. So you can have loss of fertility. Also, the penis may fracture while it's erected, and that partner may bend it too far. Injury to the female genitalia could include all of those. And that's 9 to 10 times it's just going to be soft tissue injury. Vascular injuries, blunt trauma, in the intraperitoneal space. So abdominal aortic aneurysm, if present, may worsen, and it can be presented with rectal bleeding also. So, things size up. Try to avoid discussing genital or urinary injuries in front of people. Follow the X, A, B, C, D, E. Keep your airway clear of vomitus and cesspool frequent. Inadequate breathing. Look for decat BTLS. Get your PQRST sample. Note if your patient is nausea, vomiting, diarrhea, and you may want to ask for the output of bowel movements and urinary output. And one thing you're going to need to know about your urinary output is if they possibly see redness in it. So get your vital signs and secondary assessment. Injuries, use BKBCLS and look for hematuria, and assess the patient's pain. Identify trends in pain and vital signs, communicate the mechanisms of injuries, document the result, and contact medical control for assistance if needed. So be very cautious and diligent with dealing with patients who refuse transport to the hospital. A lot of times you're not going to be able to externally tell the injuries of these patients because a lot of times it's internal injuries and they may need X-rays and CTs to determine those injuries. Patients presenting with blunt injury need to be spinal immobilized, high flow, maybe unstable pelvis needs to be stabilized. Patients may have one or a combination of injuries. Focus on ABCs if diaphragm injury is suspected. Monitor for signs of shock and keep the patient warm. So severe bruising around the abdominal wall, laceration of the liver and spleen, eruption of test and gallbladder and stomach. So a lot of things can go wrong inside the abdomen and the cavity. So just try to monitor for shock and keep the patient. Open penetrating abdominal injuries, assume the object has penetrated the peritoneum and entered the abdominal cavity. Stabilize the patient and initiate 2 large bore IV lines, preferably 18 or larger. The increase in blood pressure can cause internal bleeding, so fluid should be given in a volume to maintain perfusion, and that's usually around 90 systolic. Abdominal eviscerations, do not push the stuff back in. Do a visual assessment and cover it with a sterile gauze compresses that are moistened in the lower layers. So that's what you want to do with the evisceration. Here's some signs of shock and hematuria. All these people just need to be transported to the hospital so that they can be further evaluated. Make these patients comfortable with external male genitalia. Never move manipulating parent instruments or foreign bodies in the urethra. Identify and take the voice parts to the hospital with the patient.